Are there any nominations for chair? Yes, Alder Herbst.
I'd like to nominate Becky.
Is there a second? Alder Killian. Alder McElhaney, do you accept this nomination? Okay. Alder McElhaney has been nominated for the position of chair. Are there any further nominations? Yes, Alder Herbst.
I'll nominate Mike Martins for vice chair.
Well, let's just do chair now, and then we can do vice chair. Okay. Are there any other nominations for chairperson? Okay. With that, I'd like to take a motion to close nominations. By Alder Gisselman. Is there a second? All in favor say aye.
Aye.
All opposed say no. Motion carries, and Alder McElhaney will be chair. If you want to come on up here.
The second to close.
Dawn. Oh. Do you need your little directions?
No.
Are you done? Okay.
We don't need to.
Okay, we're ready to take nominations for vice chair. There you go, Ms. Hertz. Go ahead.
I will nominate Mike Martins.
Okay, and we have a second by Mr. Killian, I assume? Is that what, okay. Any other nominations? Seeing none, all in favor of Mike Martin, say aye.
Aye.
Aye as well? Oh, I didn't ask you. You said yes, right? Okay, sorry. Too late, you're in. Okay, okay, number 2 is establish a regular meeting date and time for 2024 term. We used to meet at 4:30. Everybody on my last committee was very gracious to go to 4:45 due to my work schedule. What's your pleasure, committee?
4:45 is fine with me.
Yeah, this time works well for me.
Good. Gary?
Same.
Okay, so we will continue that. We have number 3, approval of the 4/11/2022 minutes. In your packet, any questions or concerns? Go ahead.
I make a motion to accept the minutes.
Thank you.
I'll second it.
Thank you for a second. Any other questions? If not, all in favor say aye.
Aye.
And those have been accepted. Number 4, Human Resources Report for April.
There it is. I had a hard time finding my switch. You guys have a copy of the Human Resources Report in here, and the format has kind of evolved as the committee is interested in new areas or looking for additional information, or information may be presented in a different way. So I don't know if there's any questions on the content of the report, or also any requests as far as the format or additions in content. Just let me know and we'll be happy to work them in.
And this can be onward too. Go ahead, Gary.
Well, since I'm new, I just have to fill me in a little bit. So are we going to, is there any comment or general reaction with regard to what I'm hearing from managers is the need for more people? I'm sure that this committee has talked about that before, people leaving. Is there a sense of why people are leaving or resigning? City staff, just sort of getting some background into, because I'm hearing this from a variety of departments, and I'm wanted to get more of and the city is hearing this also, so I think the public needs get a little bit of a sense of what's happening with regard to the need for employees, for hiring and that type of thing. I don't know if you're prepared for that, but maybe at a future time.
Yeah, the Human Resources Report includes some kind of factual information regarding staff levels and turnover. We list in there the new hires as well as people who have left positions. But if you were looking for something, a more in-depth conversation, I think we probably would want to agendize that for a future meeting as opposed to discussing it today as something that doesn't really fall on any of our current agenda topics.
Right, I understand that, and I would be, but I think this would be the one spot with regard to the movement of employees in your report. as sort of an introduction to like what's happening. If there's exit interviews, do we get a sense of cultural aspects or pay, or I think we need sort of a sense of, I would need a little bit of a sense of what's going on with our staff.
Sure.
So I appreciate, thank you.
Any other questions, concerns on the report? And as we go along, we can add, we've done that last term, as things came up, we added, asked her to add information monthly. So that's not just a one-time thing. Oh, my thing just went. Okay, so discussion and possible action creating and classifying a community outreach specialist position. You want to start?
Sure. So the Human Resources Department received a request from the Police Department that was kind of precipitated by some recommendations from the Policing Task Force. We used to have a Housing Task Force officer position that was housed by a sworn officer. And that position really served in almost like a quasi-social worker function as a liaison with our downtown unsheltered population. And for various reasons, that position, the person took a different role in the department, and for various other reasons, that position has been unfilled. I believe that it was grant funded and the grant ended as well, but I'm going to call the chief up to provide some expertise on here. But essentially what this request today is to take that previous position we had and to make it into a regular, full-time, non-sworn position. And the Human Resources Department evaluated the responsibilities of the position, and we recommend classifying it in salary grade 17, which is a pay range of about $48,000 to about $67,500 annually. Chief, is it okay if I would appreciate it if you would come up and kind of talk about the need for the position. We do have your memo in the packet, but.
Good afternoon. I've got a number of comments to make, and then certainly we'll answer questions or, talk further about the position as needed by the committee. So as Ms. Vanderboom pointed out, the Policing Task Force has made the recommendation after their 20 months of meeting to continue a housing task force position within the police department. That was a position that was filled by Officer Eric Lemerand. Many of you remember hearing some stories at council meetings and committee meetings about his work. So we transitioned Eric into the crisis assessment response team. He's now an officer on that team. And in anticipation of this request, we haven't filled the housing task force position with a sworn officer position at this time. And I think there's a lot of community interest in not having that as a sworn law enforcement position, but having it as a non-sworn position, somebody who is, has social work experience, healthcare, mental health experience. And so that's what we're looking for if you look at the job description, that type of education and experience. So this person would be an outreach person, boots on the ground in our community, doing similar work to what Officer Lemerand was doing for the better part of 18 months. And I think that, Officer Lemerand made a lot of good progress and has some good results there, and I'll talk about that here in a little bit. If approved by the HR committee, I will make a request to the Finance Committee to fund the position through, my request will be for ARPA dollars, for COVID dollars, to fund the position at the May 24th Finance Committee meeting. Of course, the City Council and Finance Committee can make other recommendations if you deem that appropriate. So I just wanted to talk about for a little bit the current situation that we find ourselves in here in the city of Wausau in regards to the unhoused population. There's been some requests for data from the police department, so I do have some information and data to provide to you today in regards to our responses. So we don't track calls for service and label them as homeless or unhoused. So the way we were able to pull this data from our computer-aided dispatch system is As an officer types in comments into the system or into the reports, if they use the word homeless, then we do a keyword search for that. So we know that this is going to be information that is underreported, but this is the data that we have right now. So to give you some background, the report that I received in April of 2021, we had about 37 hours of officer time responding to incidents that were involving a homeless individual. So to compare that and fast forward to February of 2022, we had 65 hours of time devoted to those types of responses. In March of 2022, we were about the same, about 2,200 minutes as April of 21. And then last month, we had about 54 hours of response time. What these don't include are extra patrols. Our officers are regularly in the ramps downtown throughout the night, early in the morning. And we have recently been doing regular daily visits to the library, doing walkthroughs at the library. And so that's time that isn't accounted for in those stats I just gave you. So I just want to talk a little bit about some recent meetings that I've had over the last month or two, and there's some folks here that could talk further about the issues they're experiencing, if that's appropriate. But I talked with Mark Craig and some of his staff at Washington Square. They're having daily issues at their facility with people who are aggressively panhandling, loitering, being disorderly, having fights and that kind of thing. So a lot of issues down there. And so when I was there talking to the staff there, I talked to a business owner who related a story about a customer who comes regularly to the downtown area for services with their child. And as a result of a number of experiences they had early in the morning when coming to the Washington Square, that mother and that child no longer come to the downtown for service because of the aggressive panhandling and the concern and the fear that they have for coming into the downtown area. So that's just a story or an anecdote about one person having that experience in our downtown area. But I do think it's indicative of the larger issue that we're experiencing in our downtown. I met with Whipfley and at Riverside Place. They talked about a large number of their staff who park in the Jefferson Street ramp and walk across the skywalk to get into the building at Riverside Place. That's at 11 Scott Street. There's excessive garbage. There's urine, fecal matter. They've encountered people having sexual intercourse. There are people that panhandle every single time that they pass them during the skywalk. Employees describe not using the stairwells. One, it's because they don't want to encounter people who are panhandling that cause them fear, but it's also because of the smell that is within those stairwells. Even after DPWs come through and clean those stairwells, there's still a strong smell in there. I also have had a number of conversations with the library director, and I want to say too that especially when it comes to the library, they are welcoming to all. They handle a lot of things without calling law enforcement. They do a really good job of managing their business, and they want it to be a place where everybody is welcome, everybody feels comfortable coming, whether they're unhoused or not, or they're bringing kids or not. They want everybody to use the library because they have a lot of good services there. However, they do have a lot of experiences where they feel the need to call law enforcement and to use bans to ban people because of behavior. And so I'm going to talk about a number of those incidents that have been related to me from the library. And the thing that really precipitated the conversation that I had, the first conversation this year I had with the library director, was a Google review that they had. And so this is in regards to an experience that a citizen had in going to the downtown library. And this is what it said. It's from March of 2022. I want to provide a place for everyone. Every time we stop, there are people loitering outside the front entrance. Today, as I left with my kids right outside the front doors, 2 grown men were fist fighting and screaming profanities at each other. No longer feel safe going into this library with my young children. So that's what started and precipitated the conversation that I had with the library director, is this Google review and the experiences they had building up to that Google review. And they felt the need to make sure that it's a safe place that people can come to and feel comfortable at the library. And so I have a list of probably, 15 to 20 different incidents that started in February up until the end of April. And I'll just touch on a couple of these to give you an idea of what they are, but I can go through them all if necessary. A patron was found unconscious and unresponsive in one of our study booths. Paramedics were called and were only able to wake him with difficulty. A patron threatened another patron as part of an argument about potentially stolen belongings. There was mention of a knife. A patron was found sleeping on the floor of the restroom. This wasn't the first time. Some of them were threats to staff at the library. One person was screaming that the staff were threatening to kill family members. A male was banned for a week for disruptive behavior, shouting and swearing and using intimidating language towards library staff. So there's a lot of the ones that are very similar to that. A number of fights outside, just outside the doors of the library. So this is just to give you an idea of the types of things that people are experiencing in our downtown. And so I have other comments from the library director that I'll skip over for now, but one of the things that she told me is one of the most heartbreaking things with all of this is that every patron who witnesses these incidents leaves with a negative or scary perception of what should be a safe and welcoming place for families. And I think that's what we all want for our community, whether it's downtown or at the library. So those are some of the things that I've talked with business owners and others downtown about recently. And then lastly, I just wanted to talk about there's a perception that police responding to individuals who are unhoused or homeless, that we criminalize homelessness, and that is perceived as a bad thing, which I would agree it is a bad thing. We don't want to criminalize homelessness, and I think we've made great strides since the discussion about loitering in the parking ramps. Maybe 2.5 years ago, we had that discussion. We have a position that Officer Lemeron filled, and I think he did a fantastic job. Some of the data is in your packet that identified the work that he did, but our goal as a police department is to serve every citizen that we come into contact well. And we have a heart for service for people, and we don't want to bring people to jail unnecessarily. We don't want to cite people unnecessarily, and I think we have a track record of evidence of those things. So I just want to identify a few things that when we had an officer assigned to the housing task force position, some of the data that we provided in my quarterly report in Q4 of 2021. In the summer of 2020, 22 chronically homeless individuals were identified, and by September 20 of 21, 12 of those 22 had been housed. 42 persons total had contact with the housing task force and being homeless or at risk of being homeless, and at the time of that report, 29 of the 42 had housing. There's been a consistent reduction in jail bookings in 2021 as a result of the work that Officer Lemeron did, and I think that's we have an officer who is specialized and understands the resources that exist in our community. They're able to adequately connect them to resources, so we're able to serve them better as opposed to arrest and taking them to jail and using that jail space for incidents that we don't need to use jail space for. We've developed over 50 community partners, and that list is in one of my reports from 2021 in regards to the unhoused population. And I think we have very strong relationships with almost every community organization that serves the unhoused or homeless individuals. So with that proven track record of serving our community well, I hope that you can support this request for this position, and I'd be happy to answer questions if you have them.
I'll start off here. Now, when we're talking about this new non-sworn position, I guess the big question is that's community outreach specialist. Now, this is totally different and totally separate than the idea of being floated of a CSO, community services officer, that might be assigned to just the downtown area.
That's correct. It's
Yeah.
completely separate. We are working with city departments to bring a request forward to city council, but this has nothing to do with that. They're separate.
Yeah, this is okay. I just wanted to make that distinction that this is a totally separate instance, and what you're doing is replacing the services that Officer Lemeron provided before he was promoted to the CART team, promoted or assigned to the CART team.
Correct.
So, okay. And then would the duties that this position is assigned, the essential duties and responsibilities, is that pretty much then mimic everything that that Lemerin did with the Housing Task Force, or?
Yes, yes. So regular daily community contact with individuals who are unhoused and homeless, connecting them to resources, building partnerships and relationships with all of the all of the groups in our community that we need to help in terms of providing resources, whether that's housing resources or food resources or connecting to AODA treatment or mental health treatment resources, all of those things. So yes, those are very, very closely mimic what Officer Lemerin was doing.
Okay, okay. And then in addition too, I think it's, I don't know if it was in a memo that you sent us or the fire chief in endorsing the program, but they would also, this individual would also provide crisis services to individuals that say are going, that the paramedics are working with, or if someone's diverted to the emergency room, would provide some of those services also. So it's.
Yes, and I've talked with Chief Bartek. He's here if you'd like to speak with him about it. But we've talked with him. I've talked with him about working together so that when the fire department staff often has regular contact with certain individuals and taking them to the emergency room because of ongoing medical issues. And so if there's work that our outreach individual can do to mitigate some of those health risks and health issues and help reduce those calls for service, then we'd like to do that. So we've talked about how that might look and how we might liaise and work together.
Okay. And then I guess the final question is, I think then, and this was it the policing task force that identified that a non-sworn officer is the better role in this kind of position than a sworn officer, or?
Yes.
Okay.
Yes. I mean, that's my perspective. That's also the perspective of the task force, as evidenced by their recommendations. I mean, my perspective on that is, we need our police officers to do police officer things. So that is investigate crimes, respond to, traffic crashes, handle, all of those types of things that we generally think about when we think about law enforcement activities. If the city council said, hey, we're going to give you 12 more police officers, we keep them busy because there's enough traffic work to do and follow-up work to do that we could keep those officers busy. But so I don't want to take another officer and have them devoted to outreach to the unhoused or homeless. And there's obvious issues with that potentially because not everybody wants to talk to a police officer, right? So, and I think there's community perception that we're, because the police department's involved with a sworn officer position, that we're criminalizing homelessness. I don't think that's a fair assessment. I don't think that's a reasonable assessment, but that is the perspective of some community members.
Okay, thanks.
Thank you. Can you tell, I'm new here, so you have to fill me in a little bit more. Can you tell me a little bit how this works, how this new position would be with regard to the CART team? I hear a lot of good things about the CART team. Yeah. And the efforts of the police department really are all encompassing it. And how does this fit into that team and with regard to some of the other work, similar work that you do? Who does this, for instance, does this report to you or to a lieutenant, or where does this person fit within the scheme of the police department, for instance?
Yeah. So I think first of all, the position will report to a lieutenant. Potentially one of our detective lieutenants who oversees the crisis assessment response team. He also supervised Eric Lemerin when Eric was in the housing task force position. That's an option. Another option is one of our administrative lieutenants. But he or she will report to a lieutenant, to a first-line supervisor. How it fits in with the crisis assessment response team. So I think there is a nexus between the two positions, or between the two tasks and job assignments. The crisis assessment response team does a lot of acute emergency response to people who are suicidal and are actively in crisis. Sometimes that does cross over into our unhoused population. There are individuals who are unhoused that do go into crisis, so sometimes there is a nexus there and overlap of that work. But I do think that some of the population that they would each be serving mainly overlap. So I do think there's work to be done in that regard. But, the value of our crisis assessment response team is that we have outreach professionals from North Central Healthcare, crisis professionals, who we can utilize and lean on and work with to be able to access resources for anybody that we have contact with. It doesn't have to be somebody who's imminently in crisis, but potentially somebody who needs some type of higher level support. We can access those resources through our crisis assessment response team. So this position would work closely with some of those individuals within our CART team.
Then how, just fill me in a little bit more with regard to the efforts of the North Central Healthcare and Marathon County Department of Social Services. I trust they are partners, but how are they involved? I sense that the issue of homelessness is really coming into the city, into the police department, and I'm just wondering how it is, the larger, I'm calling on you to sort of explain the larger sense of homelessness in this community, as well as in the metro area, as well as in the county, really.
Sure.
I think just to gather a larger perspective on housing, on the mentally ill, how do we, this is one step, but how do we really proceed in the future, because I'm sure that there's more steps that the city can be taking as we go forth, but I just need to hear what your sense of that is.
Yeah, so I think to address part of the question in regards to the overall picture in Marathon County of the unhoused and homeless, I think we see the majority of the unhoused and homeless in the city of Wausau as a result of its close access to services in our downtown area. So it makes sense to me that we have the majority of that population within the city of Wausau. When I talk to my peers at other law enforcement agencies, they don't have the scope of response time, resource devotion that we have in the city of Wausau. So it is largely a city of Wausau issue within Marathon County. Now, that being said, to your point, Marathon County funds and operates North Central Healthcare and the Social Services Department. I would say that the services that we are able to access in our community, whether it's you and me or somebody who's unhoused, we have a lot of need for additional resources here. I was talking to a mental health professional today, and they told me that if I called and needed to get a therapy appointment in today, I probably would be looking at a month or two wait to get in, because we don't have the service providers in our community that we need. And so that's true for mental health. That's also true for alcohol and drug treatment. So we don't have an active open 21-day treatment program that we had a year or two ago at North Central Healthcare. With the facility redesign, they are working to get that reopened, but it isn't open right now. So if we have somebody who is in dire need of drug treatment and they are ready to avail themselves of those resources, it's very difficult to find a place to get them, definitely to get them inpatient, but even to get them outpatient treatment. So I think from a countywide perspective, that is a significant challenge for our community, not just in regards to unhoused and homelessness, although that is a significant issue, but on the wider scale. I mean, we've had just this year 3 people who have died of methamphetamine overdoses, which we've never seen in our community before. And so we have methamphetamine overdoses, we have heroin overdoses, and we don't have enough resources in our community. And it's a city issue, but the county runs those organizations, so it's often just seen as a county issue, but that's a city issue too. So yes, there are partners. We work very closely with them. We try to get to be able to get people into some of these resources as quickly as possible, and having the professional relationship helps. So in the case of Officer Lemerand, I think, he did a really good job when somebody said, I need alcohol treatment and I'm ready to take advantage of these resources. He would call over to the Chippewa Valley to see if we could get somebody into Ellie Phillips for inpatient alcohol treatment, and he's driven them there himself. He jumped on a plane and flew a woman to California because that's where she was from, and that's where he was able to get treatment for her, and inpatient treatment. And so that's kind of our model, that was Officer Lemeron's model, is I'm not going to just take somebody to another community and drop them off. I'm going to make sure that if I'm taking them to another community, they're going to be inpatient, they're going to get treatment, or they're connected with family who is going to care for them and watch over them. And so we've really, I think Officer Lemeron has really built a good model of how we should be going about the work. And that is not just limiting ourselves to the resources that exist here, because we recognize that they're limited and we don't have enough. So how then can we make sure that we're caring for everybody in our community in a good way and making sure they have access to those resources? So he did a really good job in that, and I think somebody who has the training and experience as a social worker or mental health provider or healthcare professional, they will also be able to do some of the same work.
Because you'll need a talented person, and that's, I guess, the trick, that will be the need in hiring that person. Can I ask why we're looking to grant, shouldn't this really be the long-term city staff person? And I know that you're seeking funding that way, but really isn't this beyond a couple years and into, and I know that's a decision of the finance committee, and eventually the city council, but I would think that is something that we really have to look at more permanent rather than a sort of
Yes, thank you for asking that question.
immediate funding type of thing.
Yeah, in my mind, it is a permanent position. It is something we do need long-term. Maybe we need more than one position long-term, but we'll see what happens with one. And so this is my mind, this is my logic, so it could be flawed in terms of why I'm going to ask for ARPA funds, and that is, I think it's the fastest way to get somebody into the position is not waiting for a CIP or other budgetary request and waiting for 2023, but rather to find funding that exists today that we can implement immediately so that we can see significant impact as soon as possible. That was my rationale. Whether that's flawed logic or not, I guess I'm not sure, but you folks can make that decision as well.
I understand. Thank you very much, Chief.
You bet.
And I'd like to clarify that it's also my understanding that this is the creation of a permanent position. The original funding source identified as temporary, but the intention, we don't usually create and classify grant-funded positions, for example, because the expectation is that those are going away. So yeah, the thought from the HR department as well was that on the understanding that this was a permanent position, so not of a limited term.
Thanks for the info, Chief. I'd like to start off by saying I worked as an older person with Officer Lemeron a few times, and I really respect what he did and how he did it. He was highly responsive and kind, and yes, I think he did a real good job in that role. I think these issues are never easy. These are challenging issues, and you talked about the perception that homelessness might become criminalized, or that it looked that way to some of the community. But my understanding is from the Wausau Police Department manual on page 385, it states very explicitly that homelessness is not a crime. Is that correct?
Yeah, homelessness is not a crime. I think I covered that earlier.
Oh, I didn't hear that Webster definition, but thank you. So yes, your manual states homelessness is not a crime. And I think when you look at Wausau historically, I think what's happened is we've seen some voids structurally and departmentally. It looked to me like the department was thrust into picking up some of these challenges, and I think it did it very well, and I'm quite appreciative for stepping up to the plate. I think what that doesn't remedy is the structural departmental deficits we see at the city level. And we've seen them not only with homelessness, but it's presented challenges with the water issue and PFAS, among others. And the city simply doesn't have a health and human services department. It's not equipped like the county in that way. Would you agree? And my tenure of active meeting time on this committee is roughly 50 minutes, so I may simply not know some of these details, but I'm not aware of any capacity like that the city has, correct?
Correct.
Okay, yeah. And so I think what the department has done has been excellent in trying to look at this from a human angle and kind of step up where there have been deficits over the years. I do think, though, and it's not your role to do this as chief or an individual, to say to the city, hey, you need another department or umbrella to put this under, because the classification is a little curious. But it might have been the police task force's role to do that. And I think when looking at this issue, the task force could have looked at it and said, hey, we have an increasing challenge. There are some structural deficits with departments, and it simply appears self-evident that we need another umbrella to put some of these things under. It did not do that, and I think once again that thrusts the department into a challenging position, and once again it's willing to step up to the plate. But I think classification of things is very important. It's not just philosophical. I think, one, when you classify something, it defines what it is, and it also defines the expectations of what that thing is. We talked today at length, and I said, when you go into a grocery store to buy an apple, you don't go to the meat section, you go to the produce section. And there's a reason for that. It sets expectations of what something is in relation to other items. So I very much support the notion of an outreach personnel member or kind of a social worker to do this. I would like to see that there's a mid and long-term aspiration of either transitioning this type of position onto ultimately a new department or a repurposed department, some sort of umbrella that fills that void, or else to keep this outreach position for the police department, but in addition, add one that's independent of the department as well. It seems to me, by coupling those two, there may be more triggering incidents of outreach in that type of dynamic. And what I mean is, it sounds like, well, there may be some day-to-day going out to identify and satisfy needs for the homeless. It sounds like a lot of it may be triggered by calls to the police or incidents, perhaps crime or suspected crime. So by really siloing this position to the police department, I think it greatly diminishes the opportunity at hand with the social worker, which would be a much broader, more comprehensive outreach if it wasn't under the department alone. So that's kind of my feeling on this matter. I did have just a couple questions, if that's okay. You had mentioned, per month, some of the hours spent on issues related to the unhoused or homeless. The last month you mentioned was 54 hours, I believe. Could you tell us kind of what the number of incidents was that constituted that 54 hours, Chief?
Yeah, I don't have that. I have the data in a spreadsheet in my office. I don't have that with me, so I don't want to speculate as to how many that would be. I was just looking for total time spent, so I can get that to you, though.
That would be helpful. And even to use an example, we may have 5 or 10 council meetings any given week, committees and so forth. But one of those may run 5 hours if it's a long, contentious agenda. So time spent doesn't necessarily, that's not analogous necessarily to the number of incidents. Sometimes it may be, sometimes it may not be. So I think that would be helpful. And then lastly, you talked about the need on the other end of the pipeline for mental health services and treatment services. And I couldn't agree with you more there. And I think the city and county, right now, we have a unique series of novel funding opportunities. And my understanding is some of them are highly relevant and applicable to stepping up treatment services, mental health services. So I think there's no time like the present. And if the city and county doesn't use those novel federal funds to do that, particularly when you're standing up here saying that there's such a need for it, and I think a lot of council members agree with you, I think that'll be very tragic and look very curious. And finally, So we know, and we saw this with the TIF thing a few months ago with the TIF lobbying in the downtown, there is sometimes some interplay between what happens at the state legislature level and things happening in the city. And I think it may be dead now, but there was an Assembly Bill 604. Have you ever heard of that?
No.
Okay, because I'd like to know, like you and the deputy chief, I'd like to know kind of what the disposition is on these types of efforts with the homelessness. And what essentially it was they wanted to do kind of camps for the homeless that would be in a defined area. Then they wanted them supervised. And then on top of that, they would then kind of criminalize sleeping and camping on other public property. So, you know, one, is this something, this type of approach, something you or the deputy chief have heard of? And if it is, what's the disposition on the department on doing something like that? And the reason I ask is, if we're going to be put in positions like this under the department, I want to make sure that the department shepherding these efforts really is doing it with the best interests of the unhoused in mind.
Yeah, so I think I am aware of other communities that have done those types of things, have created certain encampments or locations, whether that's a park or something else, for people to camp in if they're unhoused. So I am aware of that. I don't have a perspective on that immediately as chief. That would be a discussion that we would have with our city council, right? That's a policy decision that a community would make in regards to what resources are available for the unhoused in their community. And so that's a policy decision. I certainly can research and give you an opinion if you guys are having a discussion around that. The other thing I would say in regards to your commentary about the city structure is that, you know, I think we've done a good job problem solving issues in our community and trying to get additional resources to our community via the police department if we don't find the resources otherwise available. And a good example of that is our victim resource unit. You know, we see all sorts of victims of crime in our community that don't have access to those mental health services that they might otherwise need and have access to. So we've wrote a federal grant, and we have a full-time therapist within our police department that does nothing but serve victims of crime in our community. She's regularly in the schools serving children who are victims of crime. She serves all sorts of victims of crime, and it's free. And so it's an asset to our community. And it was because we identified a need and were able to bring a solution forward that might help and serve people in our community. And I see this as something similar. We're looking for the resources in our community to better serve our community. And we are not the experts in serving the unhoused population. I would say we're pretty good at it because we've been doing it for a number of years now, and we've got training on it now. And, you know, we have somebody like Officer Lemeran that's led the way for our department and how we respond. So, you know, if City Council, the policymakers decide that a different structure for the city is necessary and adding a Health and Human Services Department is appropriate and the funding exists, that's great. In the interim, we still have an issue that we need to address, and I would ask you to support this because it's an important position for our community.
Thank you. And just back to my question. So, to your understanding, police leadership has never discussed some sort of camp like AB 604 describes.
I'm sorry, the Assembly Bill you're talking about?
That's correct.
Yeah, I haven't read the Assembly Bill, so I don't know if we've discussed anything like that. We've discussed a lot of things around the unhoused and how to properly respond to it. So I'm sure that at some point we've discussed, like, is there a location, a warming center, a day center that we can have, a place where we can have the unhoused be and you know, live and have resources delivered to them? Sure, we've discussed that. I mean, we had a McClellan Street house that we opened with grant funds that was that exact thing. So yes, we've discussed that.
Thank you. And then I just want to say, yes, the department did step up for some of these challenges, and I'm appreciative of that, but I would maintain the assertion that I think if we didn't have this departmental void, then the department would not have been thrust into that position. So I hope that's remedied as soon as possible. Thank you.
Thank you.
Any other questions or concerns?
Well, I think there's a lot, I think where Mr. Killian was going, and there's a larger issue here, and I'm concerned of homelessness in this community, and I'm worried about, I'm not worried, I'm concerned about how this does make its way up to the city council, whether that be by committee of the whole or whatever, but I think, and I appreciate, your expertise on this as we go forth, because I think this is an issue that's going to be before the city, and I'm just curious to see how this would move it up to indeed the larger issue of the city council. So thank you.
Sure.
Yeah, and the normal procedure to move it forward would be, if it received approval here tonight, it would go to the finance committee for approval of a funding source, and then from there to council for consideration.
Yeah, he's
you know.
not talking about that. It's okay.
Question, then, my question then would be, what would be the sense of the motion that we would have to have this evening that would encompass what we want to do this evening? Because it's just, I don't have.
We can have a motion to create and classify a community outreach specialist position. That would move it forward.
Okay, that's the motion.
Yep.
I'll make that motion.
Thank you.
I'll second.
And we have a second. Any other further discussion on that? Go ahead, Mr. Killian.
Yes, would it be possible, because it seems like the immediacy of this with the police department is that there's not a more appropriate department to put this position under. Would there be a way, and I don't know if that's possible, given the funding mechanisms and time frame that's attached to this, but could we, for immediacy's sake, have it under the department with the understanding that if there's a more appropriate department or umbrella in the future, it could be transitioned over?
I have a question for Tony on that. I mean, we reclassify things all the time, positions in this committee. So I don't know, would you need that caveat as an amendment, or?
No, so we, reclassification is usually limited to changing the pay for a position, so we would reclassify a position to put it into a different pay category. If the city as a whole were to create a new department, or even to decide to amend a reporting structure, that would likely be a motion that would come to HR committee, just under a different formal title.
Okay.
But yeah, it doesn't have to be built into the motion, we can make those changes at any time.
Thank you, and it doesn't have to be, but can it be? Because if it is, then this certainly will have my support, but if that's not possible at the time, I understand.
Guess it can be, that's what I'm asking. It can be, I don't know how do we move forward? I'm just thinking on my feet, how do we move forward with that amendment?
I have an idea.
Yeah, I mean.
No. No,
I'm
you're not
sorry,
speaking,
but,
ma'am. You need to sit down. We don't have any public comment agendized tonight. Thank you. You can, if you want somebody to speak to somebody, you can wait till after the meeting. That was what our city attorney told me before the meeting.
I want that in writing.
Well, go ahead, Tom.
I was just wondering,
What-
is it viable, and would the committee be amenable to that? Is that possible in making such a motion with this, that if a more relevant department ever did arise, that this position could be transitioned over?
Okay, you can't disrupt a meeting.
Community development.
You cannot disrupt a meeting.
Housing counselors already.
Please sit down. You interrupted Alder Killian. Go ahead, again.
If that's not possible procedurally, I understand.
I guess it would be. I mean, we certainly could, and if the committee decides, make that amendment to the motion, and it's not good.
I'm a former HUD housing counselor.
I had no idea anybody who's going to be here. Alder Killian, would you like to make that amendment to the motion? Go ahead.
If that's possible,
Absolutely.
yes.
It's up to the committee. I'm not going to.
Yes, of course. So it would just be the motion that Alder Gisselman had made, I believe. So to create and classify the community outreach specialist position under the police department, but should another relevant department arise in the future, that consideration of transition to said department would take place.
Okay. Is there a second to that motion?
Well, I'll make the second for discussion.
Okay, go ahead, and then you can discuss. Go ahead, Gary.
Oh, for
I
the,
thought you wanted to discuss it.
well, yes, we
Go
could.
ahead, discuss.
Because I think how we move toward Mr. Killian wants us to go, I'm not, I'm on that path, but I think that is the ultimate goal for this city, I would think. So I don't know if that's that amendment is germane to the position itself, but the main motion is pretty much to the point of, for now, until the city would get its act together with regard to some other type of authority, which we may already have an authority as such, but I guess I just wanted to raise that sort of an issue as to how, when we do proceed, or how we do proceed.
I guess I would think of as the amendment is that it's just kind of sitting there. I think that, we can't really get into a lot of it right now because that's not on the agenda. But I think proceeding, this is one portion of what they're going to bring forward. I think public health and safety, I think you're going to be at public health and safety. I think there's going to be many more incidents of us talking through it, and if we need to have a committee of the whole to talk through all the elements of what we need to do. This is a spectrum of issues. This one position is just something that's needed urgently tonight. But after that, this is not the one and only thing, and it certainly isn't the end all. And so I see this as a first time position to get it started, and then we will continue to work towards whatever goals, and how we reach those goals will be those things to put in. Is it a new more positions? Is it a new umbrella? Like you said, a new department. Those things are going to be hooked into that, in a longer discussion as we go on. I guess I see this amendment as just putting it out there that we won't forget about this position when that happens, that it could be brought up for another discussion. Does that sound about right, Alder Killian?
Yeah, yes, that's correct, Madam Chair, that it just signifies intent, and intent represents commitment. Thank you.
Sure. Okay. Oh, go ahead.
Thank you, Chairman Becky. I'd like to just get past all this gobbledygook, and let's go ahead and create this outreach specialist position that we are here tonight to do and to discuss, and forget all the other things at this point. Thank you.
Go ahead, Michael.
Okay, thank you. Yeah, I have kind of concerns on the amendment, I guess. I understand the intent, but I feel like it's, and I see, housing and homelessness is a grave concern, and this is one step in the process, but I don't know if we need to tie our hands at this point in time, because it doesn't feel like it fits into this specific creation of a community outreach specialist that, it is for that individual's tasks and duties. I'm having a hard time thinking about, until a department is created, to put in the specter of moving it to a department. So I don't like that uncertainty in the amendment, that we don't know if and when a another department or umbrella or organization will be created, so why don't, let's consider the task at hand and create and classify this position, and then save the larger discussion of what we need to do on a more comprehensive and holistic approach at that point in time.
Okay. Well, we have an amendment on the floor with a second, and let's restate the amendment. So the amendment is that it is, with this position, if in further down the line that there is a better fit under a new department with the city, we would consider reclassifying it under that other department, correct?
That's correct.
Okay, that is the motion and second on the floor. All in favor, say aye. Oh, go ahead, I'm sorry.
Yes, just one brief comment there, and, I respect my colleagues' opinions on this matter, and the chief's. The intent of this would be, rather than jerry-rig a broken machine, to update that machine. So we're going on an anniversary of Wausau. How many years has it been? Obviously, we don't have a relevant department that could even deal with this, so it's thrust the police department into this matter, and that was kind of the notion of the amendment. Thank you.
Okay. Oh, go ahead, Tom.
I just want to comment to the fact that it's not just the police department. Mark Craig has put a letter in here, and we've had other information. And again, I want to make sure, if we're going for the amendment, I'm against it, because all I want tonight is the creation of the community outreach specialist, which is what we need ASAP. That's all I want. If we're going to be going down this road of amendments, then I cannot support it. Thank you.
Okay. Well, I want for the public to be clear, this still would be creating the position, even with the amendment. Okay. So, well, we have to vote on the amendment. So is everybody okay with voting? Okay, so all in favor of the amendment, say aye.
Aye.
Aye. That's 3 and against? 2.
No.
All right, so we have 3-2. Now let's vote on creating the classification for this. All in favor, say aye.
Aye.
Aye. You don't want the position. This is the, okay. I wanted to make sure.
This is the amended resolution.
Yeah, the
yes.
resolution of classifying the position. Yeah. Okay, so that did pass unanimously, and that is it. Thank you, Chief.
Thank you.
So I'll take a motion to adjourn.
And just to be clear, while public comment was not agendized on the meeting, there can be public comment at post adjournment according to open meeting laws and our attorneys.
Yep, so, but we need to adjourn. Motion to adjourn, thank you. Second. We are adjourned, thank you.